a global pandemic, formerly of the U.S. Geological Survey, still with Caltech, and she's director of the Lucy Jones Center for Scienceand Society. So, Dr. Jones, I know that in research there's complexity, but when it comes to the public's understanding of that research, the goal is clarity. When the pandemic started, there was very little of that. So based on the research that we have now, what do we now know about how this disease is actually transmitted?
Okay. At this point in the research, we can't rule out many mechanisms, but it is very clear that the primary mechanism is breathing in air that's been breathed out by a contagious person. And so it's sharing our air. We're seeing that if you're inside, it is much more likely to get transmitted than outside. We're seeing studies where once masks are required and worn by most of the people, the level of transmission is going way down. And all of this suggests that the primary mechanism is the very small droplets, what are called aerosols, that you breathe out. Even just breathing, you release them. If you're speaking, you release 10 times as much. If you're singing or shouting, you can be giving off hundreds of times more of them. Those are the vehicles that the virus is in, and it's breathing those in that seem to be the primary mechanism. Don't share your air. That can be being outside, so you aren't, you stand farther apart, the winds are blowing through. If you're inside, trap your air in your mask, because it's sharing air is sharing the disease.
You can understand the confusion. At first, we were told face masks don't help. Now they're required. We were also told you need to clean everything. Now they're saying, well, not as much.
Right. One would always prefer that the messages don't have to change. But here's a situation where the public health officials needed to say something before they knew much of anything about this disease. It was new. And so what they did is they gave the messages that they give for most respiratory illnesses, and that includes both washing your hands, worrying about surfaces, but also trying to stay away from people. That 6 feet distance, that's actually from a study in the 1930s of how far large droplets transmit or travel when you're coughing. So they had to draw on older stuff. And yes, when the message changes, you've got to work harder on explaining why. And here's a situation where we had to give messages before the science was done. We couldn't just sit around and wait till we knew. Now we know a lot more.
At the USGS, you worked on multiple disaster responses, floods, fires. I get the sense that when it normally comes to a disaster, even with an earthquake, there's a geometry to it. They happen, it's awful, but then it passes and you clean up, you dry up. This is different. We talked about the flattening of the curve back in March, but nobody said we would end the curve. Homo sapiens don't do well with a never-ending threat.
Disasters cover a range of time frames. Earthquakes are the shortest. You're right, you have them and they're over with. You still got aftershocks, you have secondary things, and then you have recovery as you try to rebuild. A flood might go on for weeks, and I think it is a lot harder to have this really long-term disaster. And one thing I've done with this is people who've asked me for advice or various ways is to focus on the idea that it's till we have a vaccine. Because if you start off saying this is just for a few weeks, then it becomes much more depressing when it doesn't end. And at the very beginning of the shutdown, people would ask me, a couple of weeks. I'm going, no, this is till we have a vaccine. What's your option if you don't have a vaccine? And, it helps if you can remember that this time frame is longer. A lot of this is a psychological process.
Do you suspect that if the state reimposed stay-at-home orders that it would work? People would comply the way they did earlier?
If it doesn't work, it's going to kill people. And this is why I'm out here talking publicly about it at all. The science of epidemiology, the things that you need to know don't require a PhD in epidemiology to figure out. The science is pretty straightforward. What it is recognizing what's proven and what's not. The disease doesn't care if you believe in it or not. And if we choose to ignore the fact that all of our actions are transmitting the disease around, more people will die. It's pretty straightforward.
Dr. Lucy Jones of Caltech and the Center for Science and Society, where if you go to their website, they have a podcast, Getting Through It, with Dr. Lucy Jones. Thanks very much for joining us.
Sure, thanks, Conan.
Saying goodbye to an old friend when we return.